Anthony Fiorello from Palm Beach County. I'm one of the 500 or so physicians that have taken the course and become an ordering physician in Florida. I think it's important for us to consider paragraph E as it pertains to diagnosis of patients for the use of medical marijuana. What's happened is been inserted that diagnoses other than those enumerated in paragraph E are to be determined by the Florida Board of Medicine. Florida Board of Medicine is not a diagnostic entity, it's an administrative entity. It deals with ethics, criminal behavior. It has nothing to do with determining clinical diagnosis by a physician. I think it's an insertion that is really repugnant to most physicians. And I hope at least all the 500 or so physicians that have already taken the exam will agree with me and let the Department of Health know.
You get a refund.
I'll search, and it's from the National Academies Press. Thank you.
Michelle Weiner, Dr. Nancy Powers, and Lorraine Fierro, if you could all make your way toward the microphone, please.
All right.
Okay, my name is Michelle Weiner. I am a pain physician. I work for Spine and Wellness Centers of America. We have a very large pain practice. We see patients in over 30 hospitals and nursing facilities in South Florida as well as outpatient. So imagine on a daily basis how many patients we're seeing with pain with muscle spasms. When we go to the hospital and we see these patients, terminal or not terminal, patients with cancer, patients who are undergoing chemo, who have nausea, vomiting, loss of appetite, pain, we can offer them a synthetic THC. That is missing all the other cannabinoids that these patients may need. In addition, we also have to tell them and justify to them why they have to wait 90 days to get the medication. As physicians, we were trained, we understand what a medical chronic debilitating condition is. We do not need to follow a list of 10 diagnoses and just use these diagnoses. So patients need access, they need their medication now, they need options, and I think the physicians are the ones who should be deciding what is a medical debilitating condition.
Thank you all for being here. My name is Dr. Nancy Powers, and I especially want to thank the 71% of Florida voters that agreed that this is going to help our state and the United States of America. I come to you today as a cancer survivor. I was diagnosed with skin cancer, and after the option of disfiguring surgery and many surgical procedures that were not working, I became a cannabis refugee, went to another state, got what I needed, and got healed. And that's what we need. This is topical. This is not even ingestible. And that's something that needs to be made aware that there are thousands, 6 million in fact, voters who want this. The other thing which is very important is to address the fact that patients should not necessarily be driving, and an outreach program with a patient collective managed by a physician will encourage the safety and education platform for our voters and our citizens and our patients. Once again, we live in the United States of America, and it's important for us to unite to help all of Florida and all of America. Thank you.
The next three speakers, Lorraine Fierro, Dr. Jeffrey Camlett, and Miles Gilman.
Hi, good morning. My name is Lorraine Fierro. I am a physical therapist. I live in the Fort Myers area. I'm looking to try to open a dispensary over in Bonita Springs. So I love all these comments here today. It's been really amazing, everyone speaking out. I had my own issues with using oils in Denver, where my daughter lives. I was very ill and got better there going to the dispensary. But above all that, the dispensaries out there are, it's nothing like other people might think. It's not a head shop. You It is more run like a pharmacy or doctor's office, where they do run your license. They are very, very regulated. The people who are in there are extremely educated. And that's what we need to do here. We need to follow some of these laws that we've seen work in the other states. And make this regulatory and make sure that people who are opening dispensaries are professionals and are in this for the right reasons. But we're all here for one reason, and that's patient care. If we can keep patient care at the core of all this and everything that we're doing, then I think everyone will be a win-win. I also believe that we need much more dispensaries than 7 growers. We're never going to be able to meet everyone's needs with that, and we need research, we need time. So thank you very much.
Good morning, everybody. My name is Dr. Jeffrey Camlett. I'm an internist, board certified in addiction medicine for over 30 years. I also run a Florida pain management clinic. Number one, the patients want medical cannabis. I do not necessarily have to charge them. They're coming to me with a diagnosis for a condition that can be billed under their medical insurance. Number two, we're leaving this up to the Board of Medicine and the Florida Department of Health. They remind us we're 2 breaths away from the oxycodone state. There are 32 killer narcotics I could prescribe to my patients, okay? And now there are pain laws, but there's not a single death ever from cannabis.
Yeah.
These narcotic medications and benzos and Adderall and everything else associated with high morbidity or mortality have conditions. Pain medications say for moderate to severe pain. And cannabis should be written for moderate to severe pain, period, and not limited to any particular description. I am also very, very concerned about clinics opening up. There are storefront clinics, and we are opening up nothing to charge cash to give out cannabis prescriptions.
Really? Seriously?
How are we going to stop this? I've already gotten 10 calls from people asking me to be their medical director and offering me so much dollars. Just like you enacted pain laws, if more than 50% of your patients on any given day are coming in to get pain prescriptions, you have to be a Department of Health registered pain management clinic. If you are opening a storefront clinic for no other reason than to charge people $200 to come in and walk out with medical cannabis because you say you have PTSD, you should be under specific rules and regulations. You're not the doctor that's writing 1 or 2 prescriptions a week. You're the doctor that's now giving out hundreds a week with no other purpose. That doctor's office exists to do nothing but write medical cannabis. I think that the Department of Health needs to address that. A Florida pain clinic now has to be a registered Florida pain clinic and inspected. That means when a patient comes in, they get drug tested, the Florida Physicians Monitoring Program is checked, and they actually have to have some clinical proof that they have the diagnosis that they have. So you can't say I have Crohn's disease, but I've never seen a gastroenterologist, or I have PTSD, but I've never seen a psychiatrist. We need to enact some rules and regulations. If this is going to be medicine, we need to treat it as medicine. And I'm also concerned is where are the follow-up visits? Do they come once and get cannabis for how long? 6 months, a year, for life? What medicine do we prescribe a patient where there's no follow-up visit with the doctor? And also, I don't see, if they have a condition and a patient has insurance again, why the doctor cannot pay the insurance under that condition while prescribing their medical cannabis.
Miles Gilman, Bruce Vonneman, and Ann Morgan, please.
Good morning. My name is Miles Gilman.
Unscheduled. Decriminalized. That's right.
I'm
It's for
a native Florida
solve all
resident,
these problems.
University of Florida College of Pharmacy graduate. I have a doctorate in clinical pharmacology and cardiovascular drug research. I own pharmacies in the state of Florida and currently a healthcare advisor to healthcare systems, governments, and universities in Asia and North America. I have a couple observations and one comment for consideration. First, we hear a lot today about dosing, disease states. Everyone's got a specific condition. And I think that across the board, patients should not be considered treated with cannabis for one plant. Everybody smokes one plant when they've got all different kinds of conditions. someone with Crohn's disease, glaucoma, pain controls, and so forth. We've heard a little bit today about topical applications, and all these should be considered when treating a patient, rather than everybody today is currently going for a plant to smoke under one condition. Second is that the federal government and the state of Florida have done an outstanding job in the past of being able to put checks and balances and controls for the right result for the patients, and that being pharmaceutical companies, physicians, and pharmacies have all been segregated historically for conflict of interest and be able to deliver and have the correct access for the patients. So I have a couple observations and maybe one comment for you. And that is that there are systems in place in the state of Florida that have been in place for a long time, over 25 years. And those are usually regulated through the Department of Pharmacy. There's specialty compounding pharmacies that have specific purposes for patient access, care, and these systems have been in place. They provide access, they provide control, and they provide accountability. I'm currently not in that business, but I consider that the Florida Department of Pharmacy has complete systems in place that provide many of the concerns and we've heard today, access and disease states and education and being able to get the drugs in the proper amount to the right patients.
Bruce Bonneman and Morgan.
I was trying to understand what he was trying to convey, but
Hello, I'm Bruce Bannerman. I'm a cancer patient from Colorado, licensed. I'm also a businessman. Started one of the first cannabis operations in the state of Colorado, from the laboratory, cultivation center, extractions, and also the rules and regulatory committees.
my daughter wants
A lot of these points that you have brought up here, especially the vertical integration model, will fail miserably. We tried that in Colorado. It literally lasted a year. It didn't work out. When you run out of product for patients that need that medicine immediately and you run out, you have to get it from other services, other vendors that are available. So having a vertically integrated business model is not very conducive to this state of work at all. It does not help the patients whatsoever. Also, the amount of dispensaries that you have should be locally governed by the municipalities. All right, you don't need to have one on every corner like a Walgreens, but there should be multiple ones that have easy ingress and egress for patients to get in and out. This should be controlled with the dispensaries. The dispensing organizations like we have in Colorado do very well. We have a long track record of this, working very well with the government, working with the police. So speaking to you as a patient, this is the access we need now, not 90 days from now. To also have a business model that's horizontally integrated, so all the citizens of the state of Florida have an opportunity to participate. This cannot go on as vertical integration.